Hello guys, welcome to Prakash Med. Today we'll learn about enteric fever. Uh, First we move to the introduction. It is mainly caused by Salmonella species. Uh, Two types of species, Salmonella typhi and paratyphi. Paratyphi, paratyphi A, B and C. A, B and C. These Salmonella are gram-negative bacteria. These organisms are gram-negative bacteria. Pathogenesis. Uh, Pathogenesis. And this first we talk about transmission, how it will get transmitted into the human body, mainly by the ingestion of contaminated food or water. Ingestion of contaminated food or water. It is mainly transmitted by the oral route. Oral route of transmission will be there in this. And risk factors. రిస్క్ ఫ్యాక్టర్స్ దీనివల్ల పేషెంట్కి పర్సన్కి తొందరగా ఎంటరీ ఫీవర్ వస్తుంది. రిస్క్ ఫ్యాక్టర్స్ ఆర్ డిక్రీస్డ్ స్టమక్ యాసిడ్, when we use more antacids, when we use antacids, and a condition like ecloradia. Ecloradia means there will be no HCl in the stomach. Ecloradia, and because of this less acid in the stomach, bacteria escape stomach and enter into the intestine. Next we move on to the infective dose. Uh, 10 power 3 to 10 power 6 is the infective dose of the Salmonella typhi A, B and C. These much organisms are needed to induce infection in the person. This much bacterial load is needed for induce infection in the person. Then entry into the M cells. Entry into M cells. These M cells are present only in the epithelial cells of intestine. M cells are present only in the epithelial cells of intestine. Then we move on to the layers of intestine. There are 4 layers: mucosa, submucosa, muscularis and serosa. Mucosa we also known as epithelial layer, then submucosa, then muscularis and serosa. bacteria when enter into the intestine, they trigger M cells to form ruffles. Bacteria when enter into the intestine, they trigger they trigger uh, membrane ruffles formation, like we see now. Uh, See, if this is a these are M cells of epithelial layer, uh, membrane ruffles are formed like this, like this. When bacteria are here, then these bacteria are endocytosed by these M cells. When these bacteria are endocytosed by these cells, this is known as bacterial mediated endocytosis. And bacterial mediated endocytosis. Uh, and then these bacteria enter into the submucosa here. Submucosa contains macrophages. These macrophages engulf the bacteria, but uh, they cannot destroy the bacteria because there will be alteration in the cell wall of the bacteria, like alteration in cell wall of bacteria. Because of alteration in cell wall of bacteria, there will be survival of bacteria in the macrophages. There will be survival of bacteria in the macrophages. Then these bacteria containing macrophage just enter into the lymphatics. Lymphatic means lymph nodes, lymphatic system, not lymph nodes, sorry. They enter into the lymphatic system. From there, they enter into the bloodstream. Bloodstream. It is known as primary bacteremia. Primary bacteremia. After bacteria enters into the bloodstream, they spread into the various organs. Various organs like uh, liver, lymph node, bone marrow, and spleen. These are endothelial syst- reticuloendothelial organs. Uh, in this multiplication of the bacteria occurs. Multiplication of the bacteria occurs. Then secondary bacteremia. Secondary bacteremia. Secondary bacteremia. Because of secondary bacteria, we can see the onset of symptoms in the person. Because of this, there will be onset of symptoms. Then we move on to the clinical features. Then we move on to clinical features. Of in fever, we already know that stepladder fever will be seen. Stepladder fever will be seen. Fever, and it is remittent fever. Remittent means there will be a spike increase in fever, and it falls down. It falls down after some hours, after few hours, but not to the normal range. But not to the normal range. If we think 98.7 degree Fahrenheit is normal, in typhoid there will be more than 100 temperature will be seen, like 103 degree Fahrenheit. Uh, there will be rise in spike like up to 103, then it falls down to the 99, not exactly the 98.7 normal. Other symptoms. Other symptoms like headache, other symptoms like headache, arthralgia, myalgia are seen in rashes. Commonly, rose spots will be seen. Rose spots, mainly maculopapular rashes. Maculopapular rashes on chest and the trunk. Maculopapular means Macula means flat rashes. Papule means there will be papule-like formation on the skin. Early intestinal manifestations. Early intestinal manifestations. Manifestations like abdominal pain, nausea, vomiting, anorexia, are common. And important signs. Important signs are hepatosplenomegaly. Hepatosplenomegaly. This means there is an enlargement of liver and the spleen. Hepatosplenomegaly, and sometimes relative bradycardia. Relative bradycardia also be seen, and neurological manifestations are rare. These are rare, like meningitis, aggressive behavior of the patient, and at last we see about the complications. In complications, mainly intestinal perforations, and gastrointestinal bleeding, because it mainly affects intestine. Complication will be seen only in the intestinal part, like intestinal perforations and gastrointestinal bleeding. Here you have a mnemonic like for NC, F for fever, other symptoms, rashes, early intestinal manifestations, important signs, neurological manifestation, complications. These are mnemonic for remembering clinical features.